The bright side of addiction is recovery. And recovery is lived experience. Hi, everybody. I'm Neil Scott. And if you're new to our podcast, we welcome you. If you've been here before, welcome back. And if you're in recovery, know or love someone who is, or you simply want to know more about the recovery process, or maybe you're a bit concerned about someone you know or love who is harmfully using alcohol or any other drug, this is the podcast for you. We carry the message of hope and the promise of recovery. And a reminder, you can find all of our podcasts at recoverycoasttocoast.org. Recent episodes have featured interviews with singer-songwriters, author Brene Brown, Broadway star Ben Vereen, and so many others, plus conversations with everyday people in long-term recovery, sharing their story, their insight, and their path. In this edition of Recovery Coast to Coast, on the road down in Texas, we visit with Diane Gradington. Now, she is a person in long-term recovery over 30 years and a proud member of the counseling community. She has a private practice in the Brazos Valley. Her path to long-term recovery has been faith-based. Here is a quick clip from my conversation with Diane Gradington.
Legal problems, I woke up in jail on the third day, and I said, this isn't working for me. And I had been crying because I knew better, I was raised by a Pentecostal mom. And so I knew better, but I wanted my life. I wanted to do what I wanted to do. It just spun out of control. We didn't know anything about treatment, my mom and I, and the people that my community, I will say. We didn't know anything about treatment, but we did know about church. So I lost my apartment because I had drugs in my apartment. And so I lost the apartment and I was homeless. So my mom and my dad said, come live with us. She and I would take walks. She taught me how to cook again. I helped take care of my dad. He was dying from alcoholism. He eventually died. I spent a lot of time in the Bible. I had no idea about recovery materials, nothing like that. And so I was in the Bible constantly, all day, every day. I had a renewing of my mind. And once my mind was renewed, then the rest of me could line up.
My conversation with Diane coming right up. And we'll conclude our podcast today with some wonderful words of wisdom from a great actor who always celebrates recovery, Lou Gossett Jr. Our website is Recovery Coast to Coast, and if you'd like to help us out financially or know of a foundation that may be interested in underwriting our program, we certainly would be very, very grateful. Our email address is recoverycoasttocoast@comcast.net. Recovery Coast to Coast is supported by Sundown M Ranch, one of America's oldest, least expensive treatment programs. They are listed in Newsweek magazine's recently released 2024 list of America's top treatment providers. Many people ask me, what is the success rate at Sundown? Well, let's back up a minute. You wouldn't ask a renowned heart institute or a major cancer institute about their success rate. Success has many factors. I will tell you this. Sundown has been treating men, women, families, adolescents for the past 55 years, starting them on the road to recovery. Each individual leaves Sundown with a plan for long-term recovery. But each individual must follow that plan, just as when someone leaves the hospital from any other illness, heart disease, cancer, diabetes, any other chronic disease, there is a follow-up plan. If the patient follows the recommended plan, chances for recovery increase immensely. Remember, addiction is a chronic progressive disease, and recovery must be managed, can be managed. There are some 25 million people in recovery in the United States. Think about that. Treatment works, but keep in mind, one does not get cured or fixed in 30, 60, or 90 days. Inpatient treatment is just the first step and requires continued care. Sundown M Ranch is one of the oldest and most affordable treatment centers in the country. They are a not-for-profit treatment program. They're not in it for the money. They're in it for long-term recovery of each and every patient. Their motto is, the patient is the reason we are here. They're located on 30 acres of land, which they own, at the mouth of the beautiful Yakima River Canyon. Their philosophy of treatment is simple. They are abstinence-based and 12-step centered. They adhere to high ethical standards, and treatment is covered by most major insurance companies. Check out their website for more information, and you can take a look-see at their facility as well. It's not far from Seattle. It's in central Washington. Sundown M Ranch, where recovery begins. Oh, it's coffee time again. I'm going to pour a big cup of dark roast, and I invite you to join me as I share my conversation with Diane Gradington. She's from the Brazos Valley area of Texas, and she'll be talking about her faith-based recovery over 30 years. Welcome back once again to Recovery Coast to Coast. I'm Neil Scott. We're down here in the great state of Texas, San Antonio to be specific, and to be even more specific, the 50th annual conference. That still blows my mind when I say it, of TAP, one of the greatest organizations in the country. It's the Texas Association of Addiction Professionals. I have been blessed to be able to come down here for the last 15 years to be the master of ceremonies and to be able to do the radio show down here and to be able to get to meet new people and catch up with old friends. And a new friend I just met moments ago is Diane Gradington. And Diane does a couple of things. She's a counselor in private practice. She's also the president of the Brazos Valley, Texas Association of Addiction Professionals. And I appreciate you stopping by. You are, I guess they would call an old-timer?
I'm an old-timer.
One old-timer to another old-timer.
Yeah.
I say hello, and I'm nice to meet you. You've been in the field for how long?
30 years.
30 years. And you've been in recovery?
32 years.
32 years.
Yes.
By golly, there's a story there, I am sure.
Yeah, I wrote a book.
Did you write a book?
I wrote a book.
What is the name of the book?
The name of the book is God Delivered Me.
Wow.
You can get it on Amazon.com. And it says, "This is my testimony." It's a short story of my testimony.
How did you get into recovery?
Legal problems, you know.
You were encouraged to go into treatment, yeah.
I came running into recovery.
I mean, nobody wakes up on a bright, sunshiny day and says, I think I'll do something about my addiction.
I think I'll do something. No, I didn't. I woke up in jail on the third day, and I said, this isn't working for me.
We can laugh about it now, but that day was not too funny.
It wasn't. I had been crying for 3 days because I knew better,
Yeah.
I was raised by a Pentecostal mom. And so I knew better, but I wanted my life. I wanted to do what I wanted to do.
Yeah. And
it just spun out of control.
You wanted to do it on Diane's terms.
Hey,
yeah.
Definitely.
Did you go into treatment?
No, I didn't. We didn't know anything about treatment, my mom and I and the people that my community, I will say. We didn't know anything about treatment, but we did know about church. And so my mom was a Pentecostal pastor. So I lost my apartment because I had drugs in my apartment. And so I lost the apartment and I was homeless. So my mom and my dad said, "Come live with us." And I went to live with my mom and dad. I think if my mom could have had a treatment facility at that time, that would have been exactly what it was. She and I would take walks. She taught me how to cook again. I helped take care of my dad. He was dying from alcoholism and drug abuse.
Family disease.
Yeah, he eventually died. I spent a lot of time in the Bible. I had no idea about recovery materials, nothing like that. And so I was in the Bible constantly, all day, every day. And I learned, I had a renewing of my mind. And once my mind was renewed, then the rest of me could line up. It took about 11 months. So I was in treatment at my mom's house for about 11 months.
What was that like?
It was like living with my mother with a new twist. I wanted to be there. I wanted to be clean. I wanted to be sober. And I wanted Christ in my life. Yeah, I eventually went to do some community service, off that jail stuff. And I went to the Brazos Valley Council on Alcohol and Substance Abuse, and there was a lady who was the director named Mary Mattingly. She's also a prevention specialist, and she's gotten her awards here and all that. She asked me if I could do all of my time there, and I said yes, and I had 200 hours. I was also a product of Bill Clinton's program coming off of welfare.
Ah, okay,
And
yeah,
so I
yeah.
had to get community service hours and volunteer hours. And so because I had all that free time, I left town after a while to come take care of my sister in San Antonio. She had had a surgery. And when I came here, I stayed for about 3 weeks, and Mary called me and said, "Hey, we've created a job for you."
Wow.
And I said, "You created a job?" She said, "Yeah." She said, "You can be a clerk if you want." And I said, "Okay." So I hadn't worked in years. Had not worked. I was, in recovery. Had been doing the drug thing. But I did. I did that. I went to be a clerk. But I started clerking, and then they asked me if I wanted to work a hotline. So I had to take training to work the hotline. And after that, someone asked me, "Have you ever thought about being a counselor?" And I said, "Not really, but what do I need to do?" And they pointed me in the right direction.
Wow.
Here I am.
And the rest is history. And you've been doing this for 30 years.
Love it. Love it.
Oh, my goodness. What does recovery mean to you today?
Oh, man. A lifestyle, a way of life. Everything is about recovery. It was kind of, hey, Susie guy. It was kind of strange that I worked with Susie. It was kind of strange that I had my spiritual thing here, and then I had my work thing here, right? And then about 6 years ago, God started showing me how to integrate that thing, how to bring it together, and He did. I've met some wonderful people along the way to mentor me into bringing it together.
God works in wonderful ways.
Doesn't He? Yeah.
Oh, my goodness.
When I gave my life to Christ, I got saved. It's not that it wasn't enough, but I needed to know about addiction. My dad had died,
Yeah.
and I got family, and we got to know about addiction. Every day there was something in front of me, materials and the learning, and it just wasn't enough to say, okay, I'm in recovery, but I needed to do more. I needed to be able to give back into my community that I had sucked so much out of.
You've worked at a number of programs during the 30 years?
I worked in prevention, intervention, and treatment. I worked at BV CASA in prevention and intervention, also in supportive outpatient treatment. I've worked at the TDCJ level with the pre-release therapeutic community. Absolutely loved it.
Some miracles there, huh?
Yeah. If you've ever been in a safe P back in the day when they first started, I loved it. And then right now I work for the Burleson Health Resource Center, which is a resource center, and the one thing that they have that the other resource centers don't have is a LCDC, and that's me.
How did you get involved with TAP?
So I wasn't working for a while. My mother-in-law was sick, and so my husband and I went to take care of my mother-in-law. And during that time, I wasn't working, and I have a friend named Mary Reyes, and Mary and I had been talking, saying, well, we need a TAP in our community. We need our own TAP, da-da-da-da-da. So Sherry Layton.
Oh, I love Sherry.
Yeah, don't you? Sherry Layton talked to Mary. Mary talked to Sherry, and Sherry came to Bryan College Station they had a La Hacienda there, and she met with several LCDCs and people in the profession and said, this is what y'all need to do. And that was probably about 4 years ago.
So she had the roadmap.
There was no need in making one up. Sherry already knew it.
Yeah.
She knew exactly what to do, and she supported us, and she has been supporting us throughout this entire journey. Yeah. So Mary was the president for a while, and I was telling Smitty, I had a conversation with him when we came back from COVID, and Smitty was saying, you need to be the president-elect, and I'm like, no, I don't want to do anything like that, because I know what's next. And sure enough, he talked me into it, so I go back and tell Mary, okay, I'll do the president-elect thing, but I don't know about that president thing, but,
What's the experience been like for you?
It's exactly what we wanted, to be able to bring that TAP into our area. It's a struggle because people aren't joining the way they should. If you're an LCDC, you need to join.
Yeah, I
said
that.
You're a CI, you need to join.
I said that from the stage the other night. I said, if you're not in TAP, if not, why not? This is your voice. This is your organization.
Yes.
I'm behind you all the way.
And we have so much to say. I've been trying to figure out, and I'm going to get with Sherry because the Medicare thing is out of control. We can't get people in treatment. And that's heartbreaking. I had a man in my office the other day, an alcoholic, a farmer all his life, and he had Medicare and Medicaid, and he was able to go to detox for 4 days.
Ugh.
And then when we tried to get him in treatment, nobody was taking the Medicare, Medicaid.
Oh.
It's like, what do we do?
Oh, Diane. Oh, that's heartbreaking.
It is.
When people want the help and they can't get the help.
And he couldn't get it.
Wow. We have a lot more to do. There's a big road ahead, and we all have to just keep plowing forward. That's all we can do. And make each day a great day.
Make each day a great day. Just be grateful for today.
Absolutely. My day is great because I get a chance to meet you, Diane.
And I got a chance to meet you. I'm glad I met you.
Yeah, thank you for stopping by.
Thank you for having me.
The bright side of addiction is recovery.
It is.
Pass it on.
Thank you.
I hope you enjoyed my conversation with Diane Gradington. By the way, I want to remind listeners of this podcast, if you would like to tell your story of recovery, regardless of the path you've chosen, just as long as you've been in continuous recovery for at least a year or more, drop us a note at recoverycoasttocoast@comcast.net. Coming up next, some recovery insight from award-winning actor Lou Gossett Jr. That'll be in just 30 seconds.
Alcohol is running your life. You want help, but can't take time away from work to get it. Where do you turn? Contact Sundown M Ranch. Sundown M Ranch outpatient programs have helped thousands recover from addiction without losing time on the job. Nationally recognized for innovative, effective, and affordable treatment programs, Sundown M Ranch will help you put your life back on track. Go to www.sundown.org to learn more.
And now, as promised, some inspirational thoughts from an amazing actor, Lou Gossett Jr.
It's been a while, but the images are still etched sharply in our minds. Dad passes out after being in a drunken rage, and not a word is said about his behavior. We come home from school bursting with pride, and as usual, no one wants to hear about it. We have a serious problem, and instead of guidance, we get the same old guilt-provoking salt-in-the-wound message. I blame myself for the way you turned out. If there was a common denominator in our dysfunctional families, clearly it was the lack of honest and open communication. What exchanges there were tended to be manipulative, confusing, and hostile. Those were the influences that shaped our ability to communicate. No wonder there was such disharmony and tension in so many of our relationships. Learning to be better communicators is a continuing challenge, but we're making progress. We're putting aside the negative influences of the past and learning from scratch. We're communicating in ways that clear the air instead of causing pain. We're being as honest and straightforward as we can. We're trying to bring the spirit of love and caring into what we say and how we say it. Thought for today? Do I say what I mean and mean what I say?
That wraps up this edition of Recovery Coast to Coast, the national podcast. If you've enjoyed our podcast, please share it with others via social media or simply by telling someone about it. You can find all of our podcasts at recoverycoasttocoast.org. If you'd like to get in touch, our email is recoverycoasttocoast@comcast.net. Please hit the subscribe or follow button. It's free, and you'll be notified the next time we publish a podcast. If you're considering treatment, by the way, for a friend or a loved one, or maybe for yourself, be sure and visit NAATP.org/AID, AID. It's got a list of those treatment programs that adhere to the strict ethical guidelines. One of them, of course, is Sundown M Ranch, but there are thousands of other good treatment programs around the country as well. And remember, if you know or someone experiencing problems with alcohol or any other drug, here is that 24-hour national helpline that offers free information and confidential treatment referrals. Spanish-speaking individuals available as well. 1-800-622-HELP. And we encourage you to check out findsupport.gov. a website designed for individuals, families, and friends. It has information about how to pay for treatment, including low-cost and free treatment options. Find healthcare support there as well. How to find help for yourself or someone else. It's all in one place, findsupport.gov. And join us next time for America's Voice for Recovery, Recovery Coast to Coast, the national podcast. And another shout out to our sponsoring organization, Sundown M Ranch, where recovery begins. I'm Neil Scott, reminding you to stay healthy, live in gratitude, and be kind to others. Remember, the bright side of addiction is recovery. Pass it on.